Shahan, as you've correctly stated, we're now looking at a second case of the COVID-19 virus that has hit South Africa, and that official number coming from the Department of Health, and the second case being confirmed in Gauteng. So let's take a look at exactly how did it get here. And of course, we know the details around the fact that we had a group of around 10 South Africans who made their way for a skiing trip in Italy. And the first case was confirmed in KZN, where we had a 38-year-old man and his wife who landed at King Shaka International Airport. They had some tests done. He was not feeling well, in fact. And that first case being confirmed on the 5th of March by the NICD. We now have the second case that has been confirmed in Gauteng. This woman we now know is also part of that first group of South Africans who took a trip to Italy. She was, of course, she was part of that particular group. She came back and had some tests done as well, and she has since been in isolation and is receiving treatment. As things stand, let's just take a look at the epicenter of the virus, which began, in fact, in Wuhan, in China. In particular, in China, we're looking at over 80,000 cases that have been confirmed, or infections rather, and we're looking at around 3,070 deaths at the epicenter of the virus. Let's take a global look, or a global picture rather, of the virus across the world. And globally, we have 97 countries affected by the virus, and we're also looking at around over 100,000 cases globally, with around 3,497 deaths. Now, when we look at our own continent right now as it stands, in Africa, we're looking at Algeria, that has now been dubbed the epicenter of the virus. It's looking at around 17 cases. Egypt coming in second with 15. That is actually where the virus was first traced. Senegal coming in at 4, Morocco with 2. South Africa also now coming in with 2 cases. Nigeria still has 1, Tunisia 1, Togo also with 1. And of course, no deaths confirmed thus far. Now, we know, of course, there are still a number of questions also being asked around the virus, especially because it seems a little bit similar to the symptoms that we display around influenza, as well as the COVID-19. They both display similar respiratory disease kind of symptoms, coughing, feeling tired and hot, etc. But both of these diseases, what makes them similar is that they're both contacted by rather droplets or formities. And as a result, some public health measures such as good hygiene is advised, as well as, coughing into your elbow or using a tissue and throwing it away immediately afterwards is also advised. How the COVID-19 and influenza viruses are different is essentially on the speed of transmission. So it's important to note that that is the difference between the two. The one has a shorter medium incubation than the COVID-19, that is the influenza. And so this means that influenza does spread faster than the COVID-19. So we are advising, of course, that people should not panic. That is the advice coming from the Health Ministry, asking people that, just to take precautionary measures. But if you are, of course, looking for any more information, please do call the helpline 0800 029 999. That number again, 0800 029 999.